The problem is, most people don't know that what they're consuming is making them sick. They know junk food is bad, but they don't realize it's causing chronic disease, and neither do their healthcare providers.
American food companies are selling the same exact products overseas without these chemicals, but choose to continue serving us the most toxic version.
82% of independently funded studies show harm from processed food, while 93% of industry-sponsored studies reflect no harm.
The USDA and the CDC are all controlled by giant for-profit corporations. Their function is no longer to improve and protect the health of Americans. Their function is to advance the mercantile and commercial interests of the pharmaceutical industry that has transformed them and the food industry.
We could replace that miserable future with something much brighter and healthier if we had the moral and political will to do so.
We are getting sick. 9 out of 10 killers of Americans, 90% of medical costs are from a weaponized food system. It's not that complicated. When I say weaponized, I mean that literally. Our processed food industry was created by the cigarette industry. In the 1980s, after decades of inaction, the Surgeon General and the US government finally said that smoking might be harmful, and smoking rates plummeted. We listened to doctors in this country. We listened to medical leadership. And as smoking rates plummeted, cigarette companies with their big balance sheets strategically bought up food companies. And by 1990, the 2 largest food companies in the world were Philip Morris and R.J. Reynolds, 2 cigarette companies. These cigarette companies moved 2 departments over from the cigarette department to the food department. They moved the scientists. Cigarette companies were the highest payers of scientists, one of the biggest employers of scientists to make the cigarettes addictive. They moved these addiction specialists, world-leading addiction specialists, to the food department by the thousands. And those scientists weaponize our ultra-processed food. That is the problem with ultra-processed food. You have the best scientists in the world creating this food to be palatable and to be addictive.
Ultra-processed foods, the kinds of foods that typically line our supermarket aisles, are engineered to be hyper-palatable and addictive. In fact, according to a study published by Gerhard et al. In 2022, ultra-processed foods meet the exact same criteria for addictive substances as tobacco products. Seminal NIH-funded research clearly shows their obesogenic effect. They drive us to overeat by as much as 800 calories per day, simply due to the quality of the food. This finding was actually precisely replicated and published last week in Japan. This is why America is facing an obesity epidemic. That's not about willpower. It's about the food system. And yet, the most recent Dietary Guidelines Advisory Committee appeared to bury their head in the sand, claiming that there is limited evidence that ultra-processed food intake increases risk for obesity in adults.
American children are fat, diabetic, and increasingly miserable as they progress towards middle age. Those yet not captured in childhood by obesity, insulin resistance, high blood sugar, and inflammatory dysfunction are likely to suffer it then, with near certainty by the onset of a declining old age. And expensively so. What might we aim for instead? Slim, healthy, athletic, optimistic, and courageous children. Strong, psychologically integrated, generous adults. Resilient, active, productive seniors still contributing to their communities, combined with either or both of much less spending or much better results for the cost.